So I'm Srinivasan. I'm a research coordinator at South Shore Neurologic Associates for Dr. Mark Gudesblatt. We do a lot of research on objective digital outcome measures, not necessarily just focusing on multiple sclerosis, but looking at all disease states, neurology related. So right now we have a lot of projects related to multiple sclerosis, an example of which is something that we're presenting at CMSC this week. It's a platform presentation regarding manual dexterity and the cognitive aspect of it. So going back to how we look at objective outcome measures, we're trying to find better ways of measuring disease status rather than the EDSS, which is kind of a widely known thing. It gives you a general overview of a patient's current disease state, and it can give you progress over time. It's not as sensitive as some other measurements can be, and so we're trying to shed light on some new tools regarding objectively measuring cognition, manual dexterity, gait, ocular coherence tomography, that kind of thing. And so the overall goal is to use kind of a combination of these granular outcome measures to create a bigger picture of a patient's disease, and so we can better treat them. And so our presentation on manual dexterity is looking at other ways that we can measure hand function besides the traditional 9-hole peg test or even EDSS. In general, for neurology, in routine care, the low-tech version of measuring hand dexterity is asking patients to do finger tapping, kind of fingers to nose, looking at tremors, and the high-tech version is the 9-hole peg test. 9-hole peg test being a plastic box with 9 pegs. You put the pegs in the holes, and you get a measurement of how fast a patient is doing that, and that is their entirety of hand function and hand cognition. And so hand function can be broken down into 3 kind of different domains. It could be strength, which is pinch strength, grip strength, sensory motor processing, and that's kind of changing how your strength is and being able to modulate it, changing the velocity and being able to fix it. So if like you hold an egg, you're able to hold it a specific way. It's not just you're squeezing it and you're breaking it, or you have completely limpness. It's being able to change the way you're doing it. And then bimanual coordination, so that's just being able to coordinate both hands at the same time. In addition to just being able to kind of move objects in space and be able to process that. And so 9-hole peg test just looks at fine kind of motor functionality. And so we're saying that there is, of course, more to manual dexterity besides how long we can put pegs in. There's a cognitive aspect to it. And so we use a cognitive test that we use in routine care called the NeuroTrax, which will measure cognition in multiple dimensions, examples of which are attention, information processing, motor skills, verbal function as well. And so we kind of look at the motor domain there that is also comprised of a bunch of different domains itself, and we sort of validate that with the 9-hole peg test. And we show that the 9-hole peg test scores correlate directly with just the motor domain, and they correlate just with cognitive domains regardless, or cognitive domains minus the motor domains. And so we can show that 9-hole peg test has a cognitive aspect to it that's not currently being measured in routine care or in clinical trials, i.e. the 9-hole peg test kind of thing. And so the end result or end goal of this would be if we can show that multiple sclerosis, for a start, is such a complex disease that the current tools we're using don't quite capture the full nuances and granularity in it, then we can kind of move towards using better measurements that will capture that, which will move patient care forward.